Yes, excellent. Well, if you don't mind, I'll record this for training purposes, if that's okay.
That's fine.
Now, let's get started. I got a lot to talk about. I know that you would probably have a lot that you want to share and converse about. Before we get into that, let's go for a brief introduction. I'll start just to break the ice. I'm Robert Rogers. I serve on behalf of County Supervisor John Joya. We think of ourselves as the health supervisor of Contra Costa County. We are big supporters of lifelong of those programs. We're big supporters of health equity in all things in our community. And you can imagine a lot of what that kind of outlook entails in terms of policy, but I could talk about more that in more detail. I am originally from Southern California. My background is in journalism and communications. I worked for major newspapers in Southern California and the Bay Area before coming on board and entering public service 9 years ago. Time flies. I still handle all communications for Supervisor Joya's office. I try to stay up on the latest in terms of not only digital technologies, but naturally, I also have a background in sort of classic argumentation, reporting, and other techniques. So I'm a father of three. My wife and I live here in Richmond, and we're just super happy to be of service. I worked with cohorts from lifelong, from residents last year, and we really had a terrific time. And we produced some op-eds that not only made a difference, but that residents can be very proud of. So it's great to meet you, Emiliano. Let me hear a little bit about you.
Yeah, so I'm a second career medical student. I also grew up in Southern California, so I'm curious where you're from.
Orange County, Brea.
Right, yeah, I'm from
My
City of
mom
Orange.
still lives there.
Yeah, my family is all still in City of Orange.
Oh,
Um,
wow. Orange is terrific. Yeah. My wife and I went to an art show at the Chapman College Art Museum about 3 years ago. It was terrific.
awesome, love it. Yeah, my family's from the Mexican barrio, or that Chapman University is unfortunately gentrifying. But yeah, but so I'm from Southern California. I'm Chicano and Indigenous and mixed and light skinned, and I there's a lot of things that are important to me. As my first career was really mostly in organizing and activism, and the work that then I decided to try to go get a medical training because I thought that I could do better, stronger work advocating for my communities with an MD behind my name. And I didn't see a lot of trans people and much fewer trans people of color becoming physicians. So here I am a bunch of years later. I'm also this is my ninth year of training, so I'm feeling ready to be doing the next thing. Um, and my areas of interest clinically are gender affirming care, HIV medicine. I also am an herbalist. I'm a like traditionally indigenously trained herbalist, and so I do a lot of integrative care. And that's a lot of those end up being my interests in real life too. A lot of LGBTQ community organizing and activism, and yeah, traditional medicine. Yeah.
Well, that's very impressive. Fantastic. And yeah, I love the idea of people not only trying new things at different stages in life, but I mean, in particular, a background in activism, having that passion, and then thinking that you can make an even bigger impact on wherever you are, with some clinical training. That's really inspiring. Way to go, Emiliano.
Thank you. Trying to get there.
For sure. Well, we all are.
Yeah.
Progress over perfection.
Yeah, absolutely.
Well, so I imagine, given your background, you might have a few ideas and a few skills in terms of persuasion. So that's really good. Before I launch into anything about op-eds or so forth, what is it from your perspective that we need to accomplish today?
Um, well, just there's a couple things I'd like to hear from you and a couple things I'd like to maybe brainstorm from you. And one is I am curious hearing a little bit more directly from you what you feel like are some of the health policy priorities for Richmond right now, or maybe a little bit more broadly for Contra Costa County, some combination of the two. And the second thing is hopefully picking your brain a little bit about what I think I might write my op-ed on, which is more about gender affirming care, maybe slightly more broadly LGBTQ care in this, like, again, precarious political moment, as you know, who reascends the dark throne. Um, Yeah. So thinking about that as, an area is something I'm already passionate about and have done a lot of research and advocacy in, and, how can I bring that to this moment in this place?
Excellent. So it sounds like what's really important for this session is we want to talk about the health landscape, the interest, my perspective on what we need to do, and then
Hmm.
we need to arrive at, if not exactly, at least a series of topics that could be your op-ed topic. And
Yep.
then we're going to reconvene in a week or so, I guess, and maybe go over a draft.
Yeah.
Is that basically the
Sounds
idea?
great. Yeah.
Okay, terrific. So let's talk about the health environment in Contra Costa County. Now, of course, Richmond tends to be like a more acute version of the entire county. As you may know, um, counties tend to provide public health resources for residents, while cities are providing more basic municipal services.
Hmm.
Also, Contra Costa County is one of the biggest counties in California, if you define that by the over 1 million club. And of course, we're part of that club. LA County and Orange County are bigger, but we are in the top 10, I believe. And
Hmm.
it's also a very diverse county in the sense that it stretches all the way to Antioch and Pittsburgh in the east, San Ramon and Pleasanton in the south. Um,
Hmm.
and so we have a very diverse county, very diverse geographically and people wise. Now,
Hmm.
what do I believe that the big issues are facing Contra Costa County in terms of public health that might be interesting for you to tackle in an op-ed? What we ultimately want to do is raise awareness and spur action, right? Awareness and trigger passion. That an activism background understands those kinds of topics. Those in a clinical background may less so tend to, but when you have that MD by your name, your opinion, whether it's on a blog or whatever digital platform or newspaper, it's going to hit different, as you know. Now,
Hmm.
health issues in Contra Costa County. The big one I would say would be continuing and persistent disparities in health outcomes based on income level and ethnic background. Those are two big ones. We continue to have major disparities in terms of African American health and
Hmm.
also Latino health in Contra Costa County.
Hmm.
Higher rates of obesity, higher rates of type 2 diabetes, of course, early mortality, higher rates of AIDS or HIV transmission.
Yep.
I mean, it runs the gamut. So
Hmm.
ethnic, and of course, income levels play a big role on this, but we have really good data regarding health disparities, health outcomes in terms of ethnic background.
Yep.
Another one that's a big issue, I believe, is the disparity of our undocumented communities and
Hmm.
their health outcomes and ability to access health resources. Now, Contra Costa County, thanks to John Joya, is really a big leader in this field.
Hmm.
We've created Contra Costa Cares and other programs that are there to provide health resources regardless of immigration status. And
Hmm.
so it's not only important to have that pot of resources there, and that's actionable, but also constantly giving the signal in our community that this is a safe space in
Yeah.
order to access health resources. And that's
Hmm.
going to become even more important now, given what we're seeing at the federal level
Yep.
and the
Yep.
level of concern and fear,
Yeah.
ultimately potentially backlash, depending on just how far into the bizarre realm this goes.
Yeah.
So we are committed to standing on the front line with our undocumented friends, neighbors, and families. We are standing for them, and health access is crucially important in that.
Hmm.
Other big issues in Contra Costa County: ethnic disparities in health outcomes, undocumented access to health resources. Another one would be um, the uh, the transitioning of health infrastructure in our community. We used to have a doctor's medical center, a
Oh,
main
yeah.
full service hospital. We don't have that anymore. And much to the chagrin and lamentation of so many around here, I'm going to tell you a little secret. I don't think it's coming back. I don't
Yeah.
think that one or any other one. I think that
Yeah.
we are. uh, the way that we provide healthcare services is rapidly changing. Now, there are good things about that. Better in terms of emergency response, mobility, obviously technological access, the efficiencies that we can get, community clinics, places like Lifelong, which we were all in on supporting right after the demise of Doctors Hospital. So
Mhm.
you are in part of the future there
Mhm.
that we still have a major, and if we were, God forbid, to have a massive crisis or an emergency, a mass casualty event, then our lack of emergency room resources would really become more acute.
Yeah.
So I think that changing health infrastructure is another big issue.
Yeah.
Another one could be, you could say, equity in terms of access to healthy public spaces. Now,
Yeah.
this one's a little tough. There are, by the raw numbers, if you look at a spreadsheet, there are a tremendous amount of parks
Yep.
in Richmond, in West County. So we have no shortage of public spaces. But
Mhm.
just because they're there doesn't mean that that's working for all people.
Mhm.
Equity in access. Now that could be safety, that could
Mhm.
be perception, that could be infrastructure, that could be maintenance, that could be linkage to public
Transportation.
transit.
Um,
All those things in our environmental design play a role in whether we go to the park or not. And a
mhm.
lot of times what we find is so many people don't access those resources because of all the barriers, the little barriers that are nudging them in different directions.
Mhm.
So those are four big ones that come to mind right away.
Yeah.
You could also talk about trauma,
Mhm.
especially in Richmond. The data on this might be a little bit iffier, but you could certainly make the case. People in Richmond, they are exposed to violence, noise, um, industrial pollutants, and so I mean, I live in Richmond. I understand this too, although I also understand that it affects us all in a different way. Uh,
Mhm.
but those definitely correlate with negative health outcomes in our communities, especially in the Iron Triangle.
Mhm.
There's five good ones right there. I could go more, and if you want to talk about an issue, I could go into some more depth on that also.
Okay, cool. Sounds good. Thank you. Yeah, I guess my curiosity is, and in some ways, I know it, and looping back around to my potential op-ed topic is Richmond is in many ways a city and a community that advocates for the health and rights of LGBTQ folks already. And I know, like recognizes a lot of the kind of like big holidays and Trans Day of Remembrance and Trans Day of Visibility and things like that. And I'm curious how much gender affirming care feels like a part of the health equity landscape from your perspective here.
Yeah. So I think that there could be a little bit of a taking for granted on that,
Hmm.
perhaps, right? I mean, we focus so much energy, especially in the last few years, on number one, our undocumented communities,
Hmm.
opening up new pathways for them. And then
Yeah.
number two, we always get to revisit the problem of, in particular, African American health disparities, right?
Yeah.
And then of course, then we can talk about Latino also, but the African American one is it's sort of been like it's one that's been around for so long. We could always go back to it. We always have more work to do there. So
Hmm.
in terms of like gender or sexual orientation, how are we ensuring that we are open to that group? They feel heard, they feel access. I guess my answer to that would be um, we feel like we're doing a good job there,
Um,
but we don't have a lot of data that suggests otherwise.
yeah.
But that doesn't mean that there are not improvements to be made, or in particular, like, with the new, especially at the federal level, with so much being unleashed, especially in terms of in our how could I best say it? Non-binary population or transgender population. These are openly under attack by
Hmm.
the Trump and this administration coming in. In other words,
Yeah.
I think about it myself. Like, it's amazing to me how 10 years from now we'll look back on this and be like, "That's so awful, so disgusting." But
May it be so.
they're talking about them the way they talked about gay people 15, 20 years ago.
And to be
But
fair, Trump is still talking about, queer people that way too. Like
yes,
not
no doubt.
non-transgender queer people. Like it's been an intentional politically divisive strategy.
Yeah.
Yeah.
So I think that my answer to this would be I
Hmm.
think so. The best op-eds are the ones that are really topical, that really they resonate with something contemporaneous, and this one really does. You have the energy there behind that. Now, do we have a lot of data about disparities or where we need to get better in Contra Costa? I don't want to say no, but it'll take some looking into it. And that's not a way of saying it's not a useful topic. It certainly is.
Hmm.
So I would definitely be, totally encouraging of this
Hmm.
approach. Then the question will become so, and we can dig up data that can support that. But then the
Hmm.
question will become, what is the thesis that we're thinking about advancing?
Yeah. Yeah. And that's part of the question that I have. I think that uh what and I can kind of zoom out a little bit from my perspective as a trans person in healthcare. That my general sense actually is that there's a bit of a healthcare desert almost, I could say, in terms of gender affirming care in Contra Costa County, which is not to say there's no services available, but there are few, relatively speaking. For me, there's surprisingly few for a county of this size in the San Francisco Bay Area. Contra Costa County has 3 half days a week, generously speaking, where it offers a gender affirming care clinic. That actually I should go check it out because I haven't actually been there. And that rotates between different sites. At Lifelong, for years, basically until I got here, we sent all of our patients seeking gender affirming care to our Lifelong sites in Oakland, and basically figured out a way to work around that with Contra Costa Medi-Cal, because we didn't have a provider who felt like they could provide that care here. And, this is compared to places like San Francisco or Oakland, where there are multiple specialty clinics for gender affirming care, for like larger populations, obviously. But yeah, it is, my sense of being a trans person, like in community, is that people often want specialized clinics where they know they're going to be treated respectfully, where there aren't going to be microaggressions, where they're just going to walk in and be treated with dignity and care and know that they're getting that attention. And that a lot of folks would actually, many people would prefer that over going to a generalized primary care clinic. Some would prefer to be able to go to a generalized, like family practice or generalized primary care clinic and get their needs met there also. So there's kind of two different buckets here from my perspective. And one is having those like beautiful supportive environments that are specifically for whether it's trans folks or more broadly for the LGBTQ community. And the other is making sure that providers across the board are appropriately trained to provide culturally affirming care.
Excellent. So I want to fully encourage this approach. I want to go in on this. I want you to do it. I think it's outstanding. Now, I want to give some tips so that you can get on your way to provide the draft. We can reconvene and talk about this.
Yeah.
Why is this such an exciting topic? There's a few reasons. Number one, it's striking several chords that are really important in a good op-ed,
Mm-hmm.
timely op-ed. Number one, there's the topical call to action, contemporaneous crisis, Trump
Mm-hmm.
administration, right? So that's big. It feels timely. It feels urgent.
Mm-hmm.
Same time, you have the benefit of what's one of the best ways to get people hooked on an op-ed and really into your argument and really receptive to it. It's hitting them with the counterintuitive, right? We are in the Bay Area.
Mm-hmm.
This is the home of progressive thought, of Harvey Milk, of whatever you want to say about that, right?
Mm-hmm.
This is the last place that we would expect gender neutral or non-binary people in our community to feel microaggressions, to feel unheard, to not be provided the kind of access to care they need. Yet it's happening right under our noses.
Mm-hmm.
Then you proceed to tell. And the fact that like it's better in some other surrounding counties and we as Contra Costa are an outlier that need to get better, excellent, right?
Mm-hmm.
Anytime you can start your op-ed by teaching me something that not only I didn't know,
Mm-hmm.
but that really reframes my worldview, really shocks me, really knocks me for a loop. I'm in. I want more.
Mm-hmm.
So expose us to the fact that there's a disparity we would never expect right here under our noses. And by the way, it tends to offend our sensibilities, doesn't it? Because we feel here in Contra Costa County like we are the pinnacle of, whatever you want to call it, liberal creed or, a tolerant, open, the kind of place where those people, right? People non-binary, trans, this is where you're talented best all over the world. They come here to thrive.
Mm-hmm. Mm-hmm.
And yet we're not doing as well as we should be doing.
Mm-hmm.
That's a powerful, provocative way to start. Now, then, what do we want to do with the op-ed? Big picture. Um, you know, brevity, 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 right? We want to go for 500 words. 750 is kind of the long ones that you'll see in the New York Times. Shorter is better. If you can do it in 400 or 500 words, let's do that. If you need
Okay.
to go, I would say try not 750 would be the outside. That's pretty long, right? If you
Okay.
can do it shorter, do it better, right?
Okay.
Be vivid. Give me people remember not data points, they
Stories.
remember anecdotes, right?
Mhm.
If you want to tell me about maybe it's your story, or
Mhm.
maybe it's a patient that you saw come in, or someone else who through a human experience really exemplifies the disparity, the terror, the crisis that we face, right? I want to feel how damaging this can be
Yeah.
through a real story about a real human, right?
Yeah.
Show me a detail, show me something, right? Show me the tear trickling down their cheek. Show me
Mm-hmm.
something that you see, right?
Uh-huh.
Then we need some data points, right? Tell me a little bit about. No, so we got to start with a hook. The
Mhm.
hook can be you may never have guessed that in this county, in this area, we would be falling way short in supporting our trans community, but it's happening. Oh,
Mhm.
there's something interesting. Or you can
Mhm.
start with the anecdote. That time when I saw this patient, and that was when it first struck me that this was really happening, right?
Mhm.
Or you could say, when the confetti flew down on the Trump inauguration, like I knew that we were under siege. Here,
Mhm.
so these are all good ways to start. Then you got to bring it within the first few sentences. You got to give me that thesis. And that thesis has got to be tight. It's got to be strong. It's got to hit. You're going to revisit it. Everything is going to flow into it. What is the thesis? I imagine it's something like, despite our best efforts or contrary to popular belief, there is a yawning disparity between the people in our community, non-binary, the health the health needs that they have today and in the future, and our ability to provide it and what we've done for it. We have fallen asleep at the switch in doing this, right? That's the thesis, right? We need more because, right?
Mhm. Mhm.
Then go down. You got to emphasize the thesis with a few data points, right? Maybe it's something as simple as there are no clinics that are specifically for this population.
Mhm.
Or maybe you have a survey that shows that people who are non-binary feel
Yeah.
afraid to go to the doctor or what, right? So those are good data points, right? If you just show me that there's no clinics for them, and
Uh-huh.
you show me that they are feeling some kind of way, that's enough right there.
Yeah.
If
Yeah.
you
Yeah.
got some more, that'll be good too.
Mhm.
Another thing, this makes for a super powerful op-ed that few people do. But if you do it, you automatically lift your game.
Mhm.
Acknowledge the other side.
You're right.
Acknowledge the problem, right?
Yeah.
Maybe the other side is now that doesn't mean give every bigot, a
Yeah.
soapbox.
No, I was going to say one of the other sides here can be cost effectiveness. The people say we shouldn't be spending our money on this, but actually it's cost effective.
There you go.
Yeah.
In other words, I'm not saying to give a microphone to some ogreness. What I'm saying is think in your mind the
Mhm.
best and most rational argument for why what you're saying isn't viable or is
Mhm.
wrong. Think of the best one
Mhm.
and then give it respect in a
Mhm.
sentence or two. Don't call them psychos
Mhm.
and tell them gently why they're wrong, right?
Mhm. Mhm.
Tell them gently, but of course, don't use those words, right?
Yeah.
But show them something different, right? I understand this, and at the same time,
Yeah. Yeah.
then when you always want to come back in the end, you can come back to the thesis. And if you had a powerful anecdote that you started with, you can revisit that at the end, loop that back, right?
Yeah.
So it's, in other words, is catch our attention, tell me what you want to tell me, thesis, support what you want to tell me with some data points, tell me how to fix it,
Hmm.
tell me why the other side's wrong,
Yeah,
and then remind me why this was important and what we need to do.
absolutely.
There's
Great.
your op-ed, right?
Sounds good. Okay.
Absolutely. And then you can use other little things. I'll just throw a couple in there.
Hmm.
Authority is big. Obviously you're an MD, you have clinical experience. If you want to throw in your own experience on this, that
Hmm.
helps, right? Anything that lends credibility to what you're saying on a personal level can only be a good thing for you.
Yeah.
Another one, think about social proof, right? Trump is the master of this, by the way. I don't even know if he knows what he's doing. But
Hmm.
when Trump always says everybody's saying this, everybody's talking that, he's using it's the old marketing slogan, but it works, right? So what I'm saying is social proof is if if um if everybody in your clinical practice is seeing the same thing, tell me that, right?
Hmm.
Or if 80% of Americans say that they want better support for their non-binary child, tell me that, right?
Oh,
Show me the social proof that we're on the right track. We
yeah.
all we all want to be comforted in the notion that there's a big crowd of people that feels the same way.
Yeah. Yep.
Now I could do a whole lot more, but we are 2 minutes over time. Oh, but
I know.
actually I started more than 2 minutes late, so I didn't really go over.
It's okay.
Um,
Yeah, yeah. Here
so
we are.
let's wrap it up. What else? Is there anything else I can do for you? And how
Well,
are you feeling?
I think this is great for today. Yeah, and I appreciate it. I appreciate both like you're helping me situate the big picture and also helping me think through like how to write this effectively.
Tremendous. Now, so you wanna dash off a draft? You wanna get something for us to talk about? And
Yep.
then what are we supposed to meet next week?
Yes, and I think we can do Thursday next week. Fine.
Let's lock it in right now.
Okay,
Let me open up my schedule.
great.
Thursday the 21st.
Yes,
And we'll do it on in the Zoom room. And
great.
what's the best time for you?
I'm actually flexible that morning. So I think Daphne had suggested that we try to have meetings at 11:30 to 12 with you, but I'm totally flexible that morning.
Okay, let's 1 second here. How about 10 a.m.?
That's great.
10 a.m. Thursday, 11/21.
Great.
And I don't. If you want to email me your draft before the meeting, I'm open to that. If
Great.
not, I know a lot of us like to push deadlines. That's okay too. I'm here for you wherever you are.
Thank you. I will do my best to get it to you beforehand.
Awesome. Well, thanks a ton, Emiliano. It's really been a
Really
pleasure to
appreciate
chat
it.
with you.
Nice to meet
And
you.
yeah, you too. And I'm super excited to see what you come up with. And I totally I support what it is that you want to say. And you really opened up a new idea for me I hadn't thought about when you asked me about disparities. That didn't come to mind, and that's often the mark of something special in
Thank
terms of
you.
persuasive communications.
Lovely. Well, glad to chat, glad to plant this seed here and in the future. Okay.
Awesome. We look forward to it. Have a great day.
Thank you. Bye.